I'm surprised how many people I've met that have narcolepsy or other sleep disorders since I got diagnosed. Working in healthcare, I think it also just strikes me how different it can look from one person to the next.
My name is Gradnigo.
My name is Diana.
My name is Laurie Braswell.
I will be attending Louisiana College, getting a master's in social work. I will eventually get my PhD.
I am a physician assistant. Currently, I work in an educational role at a physician assistant graduate school as an assistant professor.
As an occupational therapist, I help people to do the things that they need to do every day, and I've been diagnosed with narcolepsy with cataplexy.
I've been diagnosed with narcolepsy since I was 9 years old. A year later, I was diagnosed with cataplexy.
My symptoms started while I was in PA school. I did not get diagnosed until 10 years later.
It was after I had gone through undergrad, grad school, and had been working for a few years that I finally got a diagnosis. But I definitely had symptoms the whole time.
After I was diagnosed with narcolepsy, I had a woman that was a social worker, and she really followed me throughout my high school years and my college years. And she actually inspired me to go into social work.
Sometime during college, I realized I can't read textbooks without falling asleep. So I just became drawn to areas that were much less strictly academic, reading textbooks.
When I first started my undergraduate studies, I was in a new environment. I had new medication. Trying to adjust to that, adjusting to the environment brought stress.
I would leave and go home to take a nap during lunch to be able to come back and make it through the rest of classes in the afternoon.
When I went to visit the grad school that I ended up attending, I remember visiting all the classrooms and seeing the campus, and it was a very beautiful campus. And the thing that struck me was, there's no couches here. Where am I going to take a nap?
I just thought that I was really getting tired, because of all this stuff I was learning. I thought I was getting, brain fried.
There was a lot of times that I thought I was just being lazy.
I did and do have hesitations.
Once I got into the field of occupational therapy, I was just really struggling to get my notes done each day. I would have to just take a break between every patient and just sit down.
I would have an easier time staying awake in surgery, obviously. The person's life depends on it. I'd also have to do some hospital rounding and taking call, which could be on nights and weekends as well.
I was so stressed out. I was sick all the time. It kind of caused me to go back home, and, I had to put it on pause for a while.
I ended up taking a medical leave, and I was really unsure whether I'd be able to go back.
There was a point where I was like, man, it would be great if I could keep myself up and moving more than sitting down in a clinic.
That was when I realized I'm at home and just trying to make myself breakfast, and I'm just as tired. This isn't job stress. This isn't burnout. This is something real.
After I got everything situated, I jumped right back into it. I pushed myself, I worked hard, I made sure my medications was all together, and I got involved on campus, and that's actually what made me, excel.
I think I've had to acknowledge that there's 24 hours in a day. I've had to really come to terms with what my limitations are.
When I work in surgery and it's kind of that fight or flight mode where your adrenaline's just pumping and stuff, your adrenaline can't pump forever.
My mother, she always said, focus on your abilities and not your disabilities.
I've always had a passion for teaching. So when I saw this opportunity come up for teaching, I kind of thought, man, that would be really cool to do that full time.
Now with the new school, I'm going to a new school. It kind of does bring the hesitation to me because I don't want to revert back to being stressed out. So yeah, it can be mind-boggling and hesitant, but I'm fully confident within myself and my abilities. Someone who has narcolepsy that's in healthcare field, that's a social worker particularly, a question I would have is what keeps them going?
Sleep hygiene is my main thing. Taking my nightly medication, taking my daily medication is a huge one too. Without these it would be very, very hard to concentrate. It would be very hard to make it through the day without having the option to take a nap. Working in surgery and working in the clinic seeing patients, there's no option to take a nap in there at all.
I think the hospital environment is more flexible too. If I were in an outpatient clinic, I'd be seeing patients, every hour, but in the hospital, I'm working around their schedule, so I can kind of plan my day in ways that work best to manage my energy.
Now, when I work in education, it's a much more normalized schedule.
I tend to stay active throughout the day. That way I can keep myself up.
I find myself having to say in my head, this is not your fault.
Reminding myself and recognizing that it's not my job to fix every problem.
My husband is very, very good with understanding what narcolepsy is and how it affects me. And he can see it in my eyes, like if I'm starting to lag a little bit. And he's like, why don't you go lay down for a few minutes?
My doctor, Dr. Bordelon, he always said, it's okay to take that 15-minute nap. It's okay. There have been a couple incidents where I did not get accommodations. I was not given the proper resource or information. Like I really had to fight. It's always that question in the back of my mind, will I be discriminated against because I have narcolepsy?
I did cut back my hours, so I work 32 hours a week and I have every Wednesday off, which has just been an incredible blessing.
It wasn't comfortable talking about it when I worked in the surgery. Now, in an academic, in academia, they understand. I think they understand a little bit more. So, and I don't have that looming over my head where, oh my gosh, if someone in the operating room finds out that I have narcolepsy, like they are gonna think that I'm not fit to operate, which is clearly not the case.
When I was first diagnosed, I myself did not know what narcolepsy was.
You don't learn a lot about sleep disorders in PA school, I will tell you that right now.
My freshman year of college, I had a cataplectic episode and I was taken to the hospital and the doctors did not know what was going on, what narcolepsy was, what cataplexy was.
I just see so many patients too who have diagnoses that take them years to get or get misdiagnosed or, feel like their symptoms or concerns are not heard by people. I think the more we can advocate for people being more aware of narcolepsy and other conditions just helps people not to have to wait so long for a diagnosis.
What I'm going to bring to my career with this experience of living with narcolepsy is to teach my students that never assume that you know what's going on with every patient.
Just understanding that, there's the initial shock of the diagnosis, but there's also going to be a much longer process of figuring out what that looks like in the long term. Becoming more interested in sleep and sleep health has made me really passionate about protecting sleep for the patients that I work with. It's just been a very strange time to work in a hospital during the COVID pandemic.
It has also had us plan for the next few semesters, what to do. We need to have backup plans, and we need to have backup plans for the backup plans.
Having to wear masks all day, every day, which is important and essential for limiting the spread. It's hard working with babies and not being able to smile at them. I would say go for it and go become an occupational therapist.
There are so many options once you are a PA.
I would definitely recommend talking to an occupational therapist, doing some job shadowing.
You can look at the types of shifts that would be required. Let's say if you're going to be doing working in a surgical field, maybe working in an elective surgical field where you don't have to take call late at night.
I think anyone has to recognize, you can't be a superhero. Everybody's got their own limitations. Everybody's got their own things.
You kind of take those struggles and you make it into your obstacles, and obstacles become opportunities for you to become better, stronger as a person.
Doing what you can and knowing yourself and having supportive people around you makes a big difference.
It's okay to be delayed, you're just not denied. I was supposed to graduate college in December and it just took me an extra semester, so it's okay to take your time and do everything you need to do on your own pace.
I'm amazed by some of the people that I meet and what they do, and then find that they also have narcolepsy, and that's been pretty cool to see, just that it's not something that has to limit you.
Someone who has narcolepsy that's in healthcare field, that's a social worker particularly, is like, okay, yes, they did it. so I'm going to do it. And then hopefully someone who's coming into the field can see that I did it and that the person before me did it, and so on. It'll be amazing, like have that domino effect.